this question came in from @webmaster, who says, what have we learned about the infectivity of children, and how did the virus spread on cruise ships while everybody's quarantined in their cabins?
Okay, the easy question is the second part of the question. So I don't think that people are locked in their cabins 24/7. People do come out for exercise, for meals, and that is how people mix. And of course, don't forget about the crew who has to serve and service the customers and the passengers on board. And they are oftentimes, if they're infected especially, the vectors of how these infectious diseases go around. The first question about how infective are children, I think there are two parts to it. So some countries have closed schools and some countries have kept schools open. And I think that the key questions that we have to answer are twofold. One, are children actually as likely to get sick if they fall ill? Now, that goes to the question of susceptibility. So are children as susceptible as adults? Now, there are beginning to be some early evidence from Shenzhen and from Wuhan, both cities in China, to suggest that children are just as susceptible as adults. That is not confirmed yet, but that seems to be the case. Now, they can be as susceptible, that is, they will be as easily infected, but they don't seem to fall as seriously ill. So when you look at the cases, the case count has a very small proportion of children. So it appears tentatively that children are as easily infected as adults, but they don't necessarily get ill or display symptoms. Then the third and the most important question is, do they go on and infect others just as easily as adults? That is the major unknown, and we really don't have any idea just yet. We would have to look at, amongst other things, serology. That is, do people have antibodies? And we need to look at it by age groups so that we know how the mixing pattern and the infection patterns might correlate. And that's how we would be able to find out the answer to that question.